Thank you. I just wanted to acknowledge that I'm going to be sharing this information with you all on behalf of a large group of people who have been working tirelessly over the past year and a half in this collaboration. And many of them are sitting in this room. So I wanted to thank them and to welcome them to help me answer any questions that might come up at the end. For those of you not familiar with Namibia, it is Africa's newest independent country, and it's one of the most sparsely populated countries in the world. The University of Namibia was established in 1992 by an act of parliament. Its main campus is in Windhoek, and it has regional centers and campuses throughout the country. The roads in Namibia tend to be pretty good, but the distances are far, and so it can take quite some time to get from one point to the other. The Masters in Public Health program was started in 2003. This year's cohort has 13 incoming students. It's primarily a distance-based program. Faculty and students have about 15 days of contact time during the first year, which is when students take their courses. In between those contact sessions, students have homeworks and self-directed learning, and they have intermittent contact with professors via email or phone calls. The University of Washington started working with the University of Namibia in 2004. We first started working with them to help incorporate HIV/AIDS material into their nursing and health promotion programs. The HIV prevalence rate in Namibia is just under 18%. And so working on this together was a very timely and important collaboration, and enabled us to establish a relationship of trust and respect, so that when we received funding to work together on the MPH program, we were able to hit the ground running. The partners in this collaboration are geographically very dispersed. The previous slide showed you the regional campuses and centers and the University of Windhoek. And we here at the University of Washington have colleagues who are at the ITEC office. ITEC is the International Training and Education Center for Health. And we have, and it's a center of the Global Health Department here at the UW. And we have an office in Windhoek, Namibia, as well as staff that work on the project here. And we are increasingly drawing in colleagues from the University of Western Cape in South Africa as partners in this collaboration. So to keep people this geographically dispersed, communicating with each other on page and committed to moving forward, we've learned takes consistent and clear communication. Whoops, sorry. There we go. One of the things that I wanted to mention was the explicit attention that this collaboration pays towards nurturing the relationships itself. All of our meetings and workshops have specific objective goals and objectives, but also built into these sessions together are exercises or evaluation activities where each individual is asked to reflect on what they bring to the collaboration, what kinds of areas of expertise or knowledge or prior experience they bring and how they see it moving the project forward. And also talk about what they're taking away from the collaboration and how what they're taking away is making a difference in their own life or in their own profession. And it sounds, it might sound kind of corny to some people, but I can tell you that it's really working for us in this partnership, and it's helped us to develop a very deep sense of trust and commitment and motivation and hopefulness as we move forward. So now I'm going to turn to the specific objectives of the collaboration. The first one is improving retention and graduation rates of MPH students. One of the ways we identified to do this is through improving faculty skills in research and mentoring and supervision of students so that they feel more prepared to supervise and mentor the students that they have. So the UW and University of Namibia collaborated in developing a faculty development workshop along those lines. And then immediately afterwards, that workshop lasted a week, and then right afterwards, those same faculty also trained the incoming cohort of new students. In addition, we have ongoing support for student thesis work provided by several University of Washington faculty, which helps supplement the University of Namibian faculty in supporting their students. The second objective is strengthening the content and delivery of the MPH program. Before the grant was funded, there was an assessment of the gaps and strengths of the existing program, and one of the things identified was to increase the quantity of nutrition content in the MPH training. So we partnered UW expert with the UNAM expert and developed an additional nutrition unit for the MPH first year's students. And we also developed an additional strategic information unit. Strategic information, for those of you who don't know, is I think it's a term that came up with PEPFAR and includes health management information systems, epidemiology, demography, and monitoring and evaluation. So we paired different faculty at the UW with faculty at the University of Namibia to create these new courses. And we also seconded a strategic information lecturer to the University of Namibia. How they have been proceeding so far, before the grant, very ingeniously, was to draw from the different experts that they had both within the school and outside of the school and have them come in to deliver the courses. And so one of the things that they requested was to have a full-time faculty there who could kind of coordinate those different pieces of the strategic information part of the MPH program. The third objective is increasing institutional capacity for teaching public health. It's a very broad objective, and so it has a wide range of activities, and I'm just going to talk about a few of them. One is staffing support. We have a project coordinator who sits at the University of Namibia. And most recently, we were able to hire and second an MPH administrator who will help guide the logistics and a lot of the administrative duties involved in implementing a Master's in Public Health program. We think that this will be a really important position because it will free up a lot of the faculty to focus on their teaching and their own research. And so we'll see how this works in about a year. This person just started, I think, about a month ago. Another thing that was requested both at the assessment and at our first annual meeting was different areas of professional development. There's a lot of different components of that, but the one I wanted to share with you today was the Leadership in Health series. This was developed in response to a specific need expressed by both faculty and staff to get more training in topics such as leadership, management, stakeholder analysis, and communication techniques. So we developed a workshop that's a total of 2 weeks long, but separated 1 week and then 2 months back at People's Post and then another week in the workshop. We have evaluation activities lined up to see the long-term impact of this workshop series. But the immediate response that we got from participants was very, very positive. And the kind of description that most frequently comes up is that it was transformative. And I wanted to share with you just one of the quotes from, that's kind of an example of the kind of responses that we got. Oh, sorry, let me back up a little bit. The quote that I'm going to share with you, it came from a focus group discussion during the second week of the workshop. So it was from somebody who had attended a week-long workshop, went back to their site, tried to implement some of the principles and practices, and then came back for the second week of the workshop. And this is an example that he gave, or she gave, I don't know who it was. The institutional roadmap is going one way, and there are a lot of powerful people and directors. So who am I to voice my opinion? The workshop gave me courage to bring my opinion up to the table. Without the workshop, I would not have proceeded because I did not think I had any influence. but respectfully, I waited my turn to talk to the medical school directors and told them my view and the evidence behind my reasoning. It was not immediate, but I saw that a few of the things I mentioned started to appear in the new policy. I have begun to understand how to put things on the table. So this is kind of just the kind of change or transformation that we hope to see out of some of these workshops. The ability not just to apply new things that are learned, but to actually reflect on them and feel empowered by, oh, I did this and it worked, and gain confidence to go forward even further. We've also been trying to support distance learning. I mentioned earlier that the distances in Namibia are far. Previous to working on the MPH, ITEC worked with CDC and the Ministry of Health and Social Work in Namibia to set up a lot of digital video conferencing capacity. And so we're working with the University of Namibia to see how those can be adapted in the MPH program for teaching. What you see in this picture is a conference, a video conference between faculty and staff at the University of Namibia with faculty and staff at the University of Western Cape, exchanging ideas about how they run their MPH program, what works, what doesn't, and what each of those institutions has done to try to improve the training for students. We're also working with librarian staff and students to increase information management skills. This is a picture of the library at the University of Namibia, or part of the library at the University of Namibia. So the fourth objective is the most challenging one, and that is to assure sustainability and transfer of knowledge and financial assets. So one of the things that we do is there's an ongoing dialogue at the highest levels with the UNAM leadership and the University of Washington about how the University of Namibia will be able to absorb the cost of the staffing. We have formal frameworks and processes in place. We have memorandums of understanding. We've worked together to establish a Masters in Public Health working group that reviews a lot of the processes that we're involved in for this project. We're always working to identify additional funding and networking opportunities. And finally, because this is so based and grounded in collaborative practice, transfer of learning both ways occurs in an ongoing basis in everything we do. Thank you.